Hi, my name is Dr. Amy Sullivan. I'm a staff psychologist and I'm the Director of Research, Training, and Behavioral Medicine here at the Mellon Center for MS. Today I'm going to be talking about an adjustment reaction in response to multiple sclerosis. I have a patient with me, Sherry. Sherry has been treated by us for an adjustment reaction due to her MS diagnosis, and she's been with us now for several months. Today we'd like to talk a little bit about what the therapy process has been like. Sherry, you've been treated in our section now for several months under my supervision and guise, and I was wondering if you could tell me about your experience here at the Mellon Center in psychology.
Can you first tell me what an adjustment reaction is?
So, Sherry, that's a great question, and many people ask what an adjustment reaction to MS is. An adjustment reaction is a situational anxiety or depression that is in response to something that's happening in the environment. For example, in the MS person, an MS person goes through many changes to both their physical and their emotional disease process as they are diagnosed with MS. So when a person is initially diagnosed with MS, many things may change, or a person may think that many things will change. And because of that, they may develop an adjustment reaction. For example, a person may have changes in physical functioning, such as difficulty walking, such as balance issues. Did you have any of those symptoms or any other physical symptoms?
Both, and then extreme. I was tired, I was wiped out, I just felt like I couldn't function.
Mm-hmm. Which is definitely a change from probably your normal everyday activity, correct?
Correct.
And so for many people, when they see a change in their physical functioning, they start to get anxious about what this disease is going to do for me down the road. What does my life look like? What will my life look like if I'm already having these kind of changes? Did you go through any of that?
Constantly wondering what will my future hold. I mean, I'd lay in bed at night and just run it through my head over and over.
Mm-hmm. And so when we have experiences like that, it oftentimes causes anxiety or could cause depression. And so when a person is initially diagnosed, or when there's a change in functioning or a change in disease status, people will go through the anxiety reaction or the depressive reaction to the thoughts that are occurring in their head. And we call that an adjustment reaction. The good thing about adjustment reactions are that they typically last only about 3 months in duration. They're typically very treatable by way of therapy, which is something that you and I have done. And they typically don't turn into major depressive disorder, which is a more severe form of psychological illness. In your case, we've been able to treat it with therapy. Can you tell us a little bit about what the process has been like for you?
The therapy has taught me how to take one issue that's going on with me at a time. You know, don't bunch everything all together. Take one ailment, one thought that's bothering me, and just process that thought. Whereas before, everything just felt like it was closing in on me, and I didn't know how to sort things out. And you've helped me do that.
Thank you, thank you. So what we teach people is how to stay in the present moment, how to manage their stress, really how to focus on getting through day to day and not focusing on what the future may hold and the anxiety that may be in the future for the person. And so what we find is that we're able to treat the adjustment reaction or the adjustment disorder in about 3 months. Typically it doesn't persist longer than 3 months, and really never more than 6 months in duration. I think it's very important that when people are having an adjustment reaction, that they do seek the help of a psychologist that is trained in treating multiple sclerosis patients, because if not, it could turn into a major depressive disorder. Do you have any additional thoughts about the therapy process?
Well, what I like to tell other people when I'm sharing my story and talking to them is that an MS psychologist helps me deal with my MS. It helps me process it. I've referred many people saying, you know, ask your neurologist if there's a psychologist you can go see. And for me, it's worked out great.
Mm-hmm. And that leaves us with our final note, which is that when you're seeing your neurologist, if you have thoughts or anxious thoughts or depressive thoughts, please report that to your neurologist, because your neurologist can work within a multidisciplinary team such as we have here at the Mellon Center to help you get the help that you need. Psychologists are available here at the Mellon Center. We have a team of them that are here available to help you. We thank you so much for coming to report and to help other patients to understand the benefits of health psychology and what an adjustment reaction is. I thank you for listening and for watching, and if you have any further questions, please see the website below.